Usefulness of Community-Based Evaluation. This event is being hosted by the Center for Community-Based Research in partnership with the Evaluation Capacity Network. And we're really happy to have you all here today. I'm Judith Walton, and I'm a Master's of Social Work student, and I'm completing my practicum at the Center for Community-Based Research, which is located in Waterloo, Ontario. And I'll be moderating today's session along with Sherry Rezwani, who will be managing the technical side of the webinar. She's our technical expert, so please contact her through the chat box if you have any technical questions or concerns. And at this time, we'd like to take a moment to acknowledge that the CCBR office is located on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples, and is situated on the Halaman Tract, the land promised to the Six Nations that includes 6 miles on each side of the Grand River. So this webinar, Sherry, if you want to go to the next slide, this webinar today is scheduled for an hour long. The first little bit of the webinar where Rich is going to talk a little bit about community-based evaluation and its usefulness in the early childhood development field. And then we're going to move on and have some great conversations with some of the guests we're lucky to have here today. And we encourage you to ask your questions. So there's a couple of ways to do that. You can put your questions in the chat box. Or when we get to a question and answer period, you can raise your hand if you want to ask your question. And these sessions will be recorded and posted on the Evaluation Capacity Network website later on for your reference. This webinar is part of a 2-part webinar series. The first is this one, the usefulness of community-based evaluation, and we have a second webinar that will happen on June the 4th, and that's doing community-based evaluation. So please don't forget to register for that second session, and Sherry will put that link in the chat box for you so you can use that to register. This webinar series works hand in hand with some other evaluation tools that we have available for you. The CCBR is aiming to promote community-based evaluation in the early childhood development field. So we've developed some self-study evaluation tools that includes a 5-slide deck evaluation information and a corresponding evaluation workbook that practitioners in the early childhood development field can read and use. These tools will be posted on the Eval Hub, which is a platform that will be available shortly. So please make sure you follow them and stay tuned for the launch of that information. So before we move on too much further, I'd like to give you a little bit of context about both the Center for Community-Based Research and the Evaluation Capacity Network. The Center for Community-Based Research is a nonprofit organization located on the University of Waterloo campus, and it has been around since 1982. It's completed over 400 projects on a range of social issues, including over 100 projects related to family support and early childhood development. The CCBR's mission is to build responsive and supportive communities. The Evaluation Capacity Network is a national interdisciplinary and intersectional research network on the University of Alberta campus. And its mission is enhancing the evaluation capacity of the early childhood field. It draws on the skills and expertise of academics, students, evaluators, funders, and community organizations across Canada to curate and create evaluation learning opportunities, access to resources, and expertise. And both of these organizations, the Center for Community-Based Research and the Evaluation Capacity Network, offer customized support. So if you're looking for more information or some support or guidance with community-based evaluation projects, please reach out to them or visit their websites for more information. And maybe Sherry, we could put the links to the websites in the chat perhaps. So today with us, we're very lucky and excited to have a few wonderful guests. We've got Rich Jansen. Rich Jansen is the co-director of the Center for Community-Based Research and has been involved in over 130 community-based research and knowledge mobilization projects. These projects have included multi-partner research initiatives, community mobilization, program change evaluation, and needs assessment with direct policy impact. Rich's projects have focused on a large range of issues, including immigrants and refugees, community mental health, disabilities, family support, and face injustice. We also have Cheryl Kinzel. Cheryl Kinzel is the Dean of Research and Innovation at Bow Valley College and the former director of the Center for Early Development and Applied Research. Over the past 25 years, she has worked in the field of education in a variety of teaching and leadership roles in British Columbia and Alberta. Cheryl's research interests are social emotional well-being in the early years, Indigenous knowledge systems, reconciliation, and culturally specific curriculum. And we also have Rebecca Gokert. Rebecca is the Associate Director of the Community University Partnership of the Study of Children, Youth, and Families, and leads the development of the Early Childhood Measurement and Evaluation portfolio as Director of the Evaluation Capacity Network. Rebecca is a registered psychologist who provides consultation to school boards within Alberta, and Rebecca's current teaching and research focuses on community engagement, partnership development, and sustainability, and is primarily in collaboration with early childhood stakeholders, immigrants, refugee, and First Nations communities. So welcome to all of you, and thank you for being here with us today. So at the end of today's webinar, we hope to have enhanced your understanding of community-based approach to evaluation, understanding the usefulness of this approach to early childhood development programs, and also the usefulness of this approach to early childhood development sector. We're going to talk a little bit about community-based evaluation to start, and then we're going to have a discussion with our guests on the usefulness in programs and also the usefulness in the sector as a whole. And we will have some time for you to ask your questions as well. And so, Rich, can you tell us a little bit about community-based evaluation?
Yeah, thanks, Judith. And hi, everyone. Glad that you could all join us today. And it's a pleasure to be here with my colleagues, Rebecca and Cheryl, and look forward to a good conversation. So I'll just kick things off by talking a bit about community-based evaluation. And to start off by saying that we can get into the business of evaluation for different reasons. And here, this slide shows some of the drivers of evaluation. Perhaps traditionally in the past, a lot of evaluation done by practitioners was more reactive in response to requests, maybe demands of a funder for the sake of accountability. So the motivation more externally focused. Today, we're hoping to kind of shift that as in the field of evaluation has really shifted the drivers of evaluation to be more proactive. Organizations seeing the internal motivation of having evaluation help to develop a healthy organization, improving the organization, helping to shape and form what you do in your programming. If you're in the space of innovation and complexity, evaluation can be a talking partner with your management group. So for adaptive management and seeing evaluation as being part of co-creating the interventions that you want to create. And so when we think about the term useful evaluation, which is the title of this webinar, we think of two things. Not only doing the evaluation, doing it for the reasons that make sense for your organization, for your program, for your group, but also using the results of the evaluation in your decision making so that you can have healthy organizational improvement and that you can have adaptive management if you're developing innovation. And we'd like to think that, in the next slide, that a community-based approach can help your evaluation to be more useful. And really that's the pitch of this particular webinar, is to answer that question: how can a community-based approach to evaluation actually make it more useful? That you see, if you're a practitioner, that you see the value of evaluation for what you are doing. And so that begs the question, what do we really mean by community-based evaluation? What does that qualifier community-based mean? How do we know if we are actually community-based? So I'll just take a few minutes to just go through some slides here that those slide decks that Judith mentioned unpack in a lot more detail. But this is just the Coles Notes, the short version. And when we think about community-based evaluation, we think about its hallmarks, 3 hallmarks. That it's evaluation that strives to be stakeholder driven, participatory, action oriented. Stakeholder driven meaning that you have, as a practitioner in your program and in your organization, you have your hands on the steering wheel of that evaluation. It is your evaluation. You may involve other people, but it's your evaluation for your purposes, and your unique theory of change drives that evaluation endeavor. Participatory, you ask who has a stake in our program, and how do we meaningfully involve them throughout the evaluation process. And action-oriented means that we don't just do the evaluation and get a report, but we're also thinking about how to use that evaluation findings in the decision-making of the organization. 3 hallmarks followed by 3 goals. In a community-based approach to evaluation, yes, it is research, so we produce new knowledge, we gain insights, we learn something by asking questions and summarizing those answers, but that's not enough. That we also push ourselves to share those results, to communicate that, to mobilize that knowledge in ways that people can actually use that information in good decision making. And yet that's not enough. In a community-based approach to evaluation, it's, on the previous slide still, it's a very relational exercise, that we engage people through the community, through the evaluation, so the evaluation itself becomes an intervention in creating and building stronger relationships among stakeholders. So 3 hallmarks, 3 goals, and now 4 phases and 11 nonlinear steps. This is the map, the GPS. This is what the workbook that Judith mentioned unpacks and goes through and has exercise, concrete exercise for people to understand. You'll notice that there are 4 phases, not 2, as in some other more maybe conventional approaches to evaluation, where you do phase 2 of planning the evaluation and phase 3 of implementing it. It adds 2 phases of laying a good foundation and making sure that we act on the findings. And in today's webinar, we're focusing on that part, the use of evaluation. How do we get to that phase 4, that it's actually a live evaluation that is of utility to your organization? So those are the 4 phases, and if you count up all those little points, those are the 11 nonlinear steps. So if you want a summary definition, some people like to have just a 1-sentence summary of things. Here's a summary definition of a community-based approach to evaluation. That it's an approach that involves active participation of stakeholders, meaning those people whose lives are affected by the issue being studied, in all phases of the research and evaluation, for the purpose of making useful results to make positive changes in the program. And just one last slide before we shift over to Cheryl and have a conversation. When we think about usefulness of evaluation, that assumes that there needs to be capacity within organizations to be able to do and use the evaluation results. And this is a diagram that I think Rebecca's ECN has developed that shows 3 different levels of evaluation capacity building. That in order to have evaluation useful, people within the organization, they have to have individual capacity to do evaluation and know how to go about using the results. But there's also an organization culture that needs to support and enable evaluation. And so that's another level of capacity building that's often, we often talk about. And then finally, there's a broader environment that needs to enable evaluation. And this is perhaps funders or other policy people, perhaps some of the networks that you're involved in, that build capacity, provide support, give the guidance, give the policy frameworks for evaluation to be useful. And in today's webinar, Cheryl will talk mostly about the individual and maybe a bit of the organizational level, whereas Rebecca will talk more about the enabling environment and maybe touch down into the organization. So that's how we've organized this webinar. So back to you, Judith.
Yeah, great. Thank you, Rich. So we'd like to chat with Cheryl a little bit. And we have a couple of questions for you, but I was wondering if maybe you could start by just telling us a little bit about your connection to early childhood development.
Sure can. Thank you, everybody, for inviting me on here and accommodating my need to jet quickly halfway through because my daughter's getting vaccinated today. So thank you for that. I have been in the field of education for, I think, really since I graduated from high school, which was a long, long time ago. I've spent about 12 of those education years in the early childhood sector, both private and public centers. I was the director of a center. Then I transitioned into being an instructor for the early childhood diploma with Bow Valley College. I worked with the Stoney Nakoda First Nations there, teaching there for 2 years. And then I transitioned to main campus, was program chair and then director of the center. And now I've moved to a new department, but my heart still lies with ECD.
That's great. Thank you. And so tell us a little bit about what led you to see the importance of evaluation in early childhood development programs.
Well, I think it started when I had my own center and I started to interact with, at the time I was in BC, and I really, the only people you interact with are the public health officers. And I remember having conversations with the public health officer assigned to me about, you know, she probably overshared a little bit about different centers in the area I was in. And it was a bit shocking to me that there could be such a range of what I perceive to be quality in the centers, because the requirements for certification were, you know, the licensing requirements are pretty bare minimum, I would say. So I started to think about how people could work with evaluation. And then when I became a program manager of a large center in Calgary, you see a lot of different ways to evaluate. You know, you see the evaluation of children, you're using the ASQ or the NIPSing or other tools. You see the evaluation of caregivers, like the ARNET caregiver interaction scale or class. You see the evaluation of the rooms using the ETTers or the ICRs, things like that. And then the whole program can be evaluated. And most of my experience with evaluation from a programmatic perspective has come while in Alberta and really strongly tied to the accreditation system we used to have. And I think some real strengths can come out of that.
So tell us about the strengths. Are you seeing evaluation being useful in people really understanding what's working and what's not working in the program?
I do. I think that evaluation, like a program, well, all of the evaluation can be useful for different reasons, but a program evaluation, I think, really gives you insight into things that you wouldn't necessarily think of. So we all have our own lenses that we're looking through, and our own cultural lenses that we look through as well. And that'll come into play later when we talk about a community-based approach and why that's important. But I think that having a system of evaluation, and again, back to, you know, the accreditation system we had here in this province, it's really valuable because it looks at so many different aspects of the programming that may not be considered.
Yeah, not to put you on the spot, but do you have any examples maybe of that where evaluation has helped in understanding?
Absolutely. So when I was in my previous role, we were trying to understand why some rooms were more popular than other rooms, I guess, and you know, immediately you kind of hone in on the caregivers in each room, and you think, well, that must be the reason why, instinctively. But once you go through the system, like a full system of evaluation for the program, you come to realize that there are so many factors contributing to the culture of an individual room in a childcare center, and that helps you to identify areas that you might want to consider making changes in.
Interesting. And I guess that this helps with decision making as well. What do you have any examples of, managers using this for making wiser decisions?
Well, yeah, and I wouldn't know that I would be able to pull a specific one because it has been a significant number of years since I was in the field. But I would say that it does inform your decision making, and it guides you because of the kinds of questions you ask. It guides you towards understanding, I think, is really what you're looking for, the understanding of the system and the strengths and the challenges and the opportunities. And then that in itself would guide you towards being able to make different choices that would then also need to be evaluated, because you won't know until you
right. More educated decisions, and then evaluation from there. What about the community-based approach specifically? How do you feel that makes evaluation more useful using a community-based approach?
Well, this ties in, I would say, specifically with my own research interests and my own experiences teaching and working in early childhood. And I think that really a community-based approach is the only approach to evaluation when you are working with humans from different places. So, or from the same places, or different values, or different beliefs, or, I mean, there is no uniform one way of being that is correct. There isn't. There's no normal from that perspective. And I think that when you are looking at a specific childcare center that sits in a specific community, and that specific community has their own beliefs and values and norms for their children and their expectations of what programming you would see, and that should be the guide. That community should be developing their own evaluation because they are going to know what they put value on and what is important to them, and what is important to them for their children to learn and continue, and places for their children to be in. So to use a very concrete example for this, when I first started teaching in Minithni, which is also known as Morley in Alberta, I walked in with my full scope of Western European early childhood practices, and I was going to teach those. And it occurred to me really quickly that was really not appropriate in the area I was in. And what I needed to do was connect with community and learn from the community elders and parents about what expectations they had for early childhood centers in their community and how that should be for that community. And we co-constructed a curriculum together that was community-based. And I feel that way about evaluation. We shouldn't be taking norms and beliefs and values from another area and trying to place that everywhere, because it just doesn't work. And the more the community develops their evaluation practices, the more invested they are, and the more positive I think the outcome would be.
Right. Fantastic. That's a really great example. I do think I know that you need to leave in a little bit. I think we have some questions. Sherry, can you help me out? Do we have questions for Cheryl?
Yes. We have one question here. What was it about the rooms which caused some to be more popular?
Excellent question.
Well, it was a combination of things, actually. It was, in some instances, it was just the energy and behavioral mannerisms of the educators. But it wasn't only that. It was also how the room was actually physically set up. It was in this particular room that was popular, it was the fact that they didn't firmly dictate to a schedule. It wasn't like snack is at this time and art is at this time. It was really open and free, and the children could move around at their own paces and do their own things. And it wasn't until there was like the fulsome evaluation done that we came to understand the variety of factors that were involved.
Interesting. That's very interesting. Rich, do you have any comments or any questions for Cheryl?
Yeah, like I really like what you're saying, Cheryl. Like in some sense, what I'm hearing you say is that evaluation can be demystified. Like a lot of people have a lot of fear, maybe is a strong word, certainly hesitancy towards evaluation, especially if it's in the reactive mode when you're needing to do it for somebody else's agenda as opposed to your purposes. And sometimes we feel that evaluation is a really technical process that requires a lot of expertise. And from what I'm hearing you talk about in a community-based approach, it doesn't have to be more complicated than good reflective practice. Yes, maybe there are some technical aspects that you might need to have other people support you with. And I think Rebecca can talk about that in a moment. Or maybe you have examples, Cheryl. Well, you now have shifted from a practitioner to the campus. You can draw on other expertise, but even so, you can still retain the control of the evaluation agenda and make sure that it's not overwhelming you, right? When we were piloting these slide decks for this self-guided, study on how to do a community-based approach to evaluation, we did that piloting with a group of organizations in Ontario. There's an Ontario network of community action programs for children, CAPC. Many of you might be familiar with the federally funded CAPC initiatives. And some of the responses in our focus group after they had time to go through the slide decks themselves was when I started and saw all the slides, and based on my past experience of evaluation, I thought I was going to be overwhelmed, right? Because here's a lot of information, here's high expectation. Evaluation is research after all, and research can put a knot in some people's stomachs. But when you break it down and you realize it's really about what I want to learn and what we want to collectively learn within our organization, that's kind of like what I do in how I deliver my own services in that type of a way. So it's a very similar approach to how I deliver services. And that fit between the intervention approach and the evaluation approach, I think, is a really strong indicator of being useful in the evaluation.
I agree. And I think that I think for me, thinking about my experiences in Minithni and the community's experiences, I think that it's about control. When you are in control of the evaluation and how the evaluation is being done, then it's good, and you're engaged and you feel that it's valuable.
Mm-hmm, mm-hmm. That's a
And
great
I am
point.
going to go now and vaccinate my child.
Yeah. So
Thanks,
thank you,
everybody.
Cheryl. Really appreciate having you here.
Take care.
Thanks. Great. That was very interesting. And so let's, Rebecca, I have I'm going to start with a similar question with you. Tell us a little bit about your connection to early childhood development.
Sure. Thank you, Judith, and welcome everybody to today. I see some familiar faces in the participant list, so welcome, and it's nice to see you virtually. So I'm not sure everybody wants my history or backstory. Maybe it's long, perhaps somewhat boring, but I'll give you kind of the Coles notes about my connection to ECD and evaluation, because they're actually fairly inseparable. So as you mentioned in my introduction, Judith, I am a child psychologist by training. So I spent much of my earlier career doing evaluations, not of programs, but of individual children. So those assessments, screening, and then based on those results and assessments, making recommendations within school-based contexts. So really the tenets of good evaluation, we gather good evidence, we triangulate that evidence, and we use that evidence in decision-making. So during this time, actually similar to Cheryl's experience, I was doing a fair bit of assessment work in First Nation communities. And I was also troubled by the tools that I was using, how relevant they might have been within the context in which I was working. So I became really keenly interested in how screening and assessment tools were built. That's sort of the nerdy part of me coming out. I got really interested in measurement. And actually, went on a pathway to complete a PhD in measurement, evaluation, and cognition. So this really solidified my theoretical training in evaluation as it related to early childhood. And then my first position at the university was to lead the development of an early childhood measurement and evaluation resource center. And from that moment, I became deeply invested in really understanding what the practical needs of the early childhood sector were when it came to screening, assessment, and evaluation, and then working collaboratively to determine how to fill these needs. So my academic career has been focused on community-based and partnered research in the early years. While working alongside community-based organizations like Head Start, Early Learning and Care, that's very grounded in practical issues. Certainly my connection to ECD was cemented when I had children of my own. One just ran through the back of the room looking for the iPad because we're doing homeschooling right now. So now I was on the other end of that evaluating, right? Evaluating every move, their developmental milestones, comparing that against everything I could observe and read at the time. So I think now I'm probably going to have to shift my career focus to adolescence, right? As my children are getting older and I'm feeling, somewhat unprepared. Maybe go brush up on my reading and a youth engagement for now. So that was my brief, maybe not all that brief history, but certainly the last probably 15 years of my career has been working very much in partnership with the ECD sector.
That's great. Thank you. So tell us a little bit then about your insights on the usefulness and importance of evaluation in the kind of broader early childhood development sector.
Sure. Thanks, Judith. So, given some of the names I can see on the participant list, I know I'm preaching to the choir. All of you work in the sector and or you interact with it in some way. So of course, you're probably, deeply invested in the research, and we know that environments and experiences that children have in their early years, as Cheryl was talking about, they really shape long-term growth and healthy development. So physical, social, emotional, cognitive development. We know it's a period of rapid development, learning and opportunity for kids. We also know that this is a fairly interdisciplinary and intersectoral area. So it's not just education, it's not just, early learning and care, it's just not families or health that, wraps around children as they're growing and developing. It is quite, multidisciplinary. So it doesn't just fall into one, but we also know that across all of these disciplines, maybe we have different perspectives, as Cheryl talked about, different kind of viewpoints about, what does healthy child development look like and how do we best support it? We certainly know that we want to pay attention to the energy that we're putting into this, the investments, both financial in terms of human resources, the time. Is it impactful? Is it making a difference? And those are kind of the big driving questions, certainly. We have as parents, we have as educators, we have as funders, we also have, across our country, certainly. I turn to evaluation, and I know that we can turn to evaluation to help us answer these questions. But I also know, in working fairly closely with the field, that, as Rich talked about, evaluation is not only the ability to do it, so some of that knowledge, skills, and motivations around it, but it's also the ability to use that information really to make sense of what are we learning, how can we use that from a learning orientation to make shifts in the programs that we're offering, even our daily practices, so really that reflective practice, and even all the way up to driving some of the policy decisions that we make around early childhood.
And so I'll do the same as I did with Cheryl. So hopefully this isn't an unfair or put you on the spot, but do you have any examples? You mentioned using the information to make things better, to make shifts in what's being done. Do you have any examples or an example that you could share where that's being done?
Sure, certainly. So a project that we worked on for several years, actually, it was a supportive teen housing project. So it was a pregnant and parenting teen organization, TERA, which is located here in Edmonton, Alberta, and a housing group got together to really wrap supports around young families that were raising young children. We worked very collaboratively. So from a community-based evaluation perspective, it was all in, it was participatory, and the entire purpose was building a model. So building a model of supportive housing, because one didn't exist. And we really need to understand, what should that model look like? What kinds of practices should be in place? What kinds of interventions, what kinds of supports are needed to really support these families as they're raising their children and raising them in really supportive environments. So we took that as our learning orientation. We built the mechanisms right into the evaluation where we often met. So we met, we had all these different kind of steering groups and different committees where we met regularly, looked at the information we were gathering, and right away made programmatic changes. Oh, the policies we have for how we're inviting families into this program aren't working because actually our families aren't being successful. So let's look at those policies right away. So actually it was rapid change. So as we were sort of building this model, we were constantly reflecting on the data that we were receiving and even looking at how we were gathering data. So a perfect example is we wanted to do child assessments with these families to look at growth and development over time, parent-child relationships, and none of our teen families wanted to engage that way. So we used every trick in the book and we were working really closely with service providers, but that is not how they wanted to engage. So we asked the participants themselves and said, what are you interested in? And they said, we just want to tell you, what does it mean to raise healthy kids? We want to talk to you about some of the challenges that we're faced with and some of the solutions that we have. So actually we used an approach called photo voice, which I'm not sure if people are familiar with, but we put cameras in the hands of our participants and they went off and took images of what it meant to raise healthy young children. They brought those back. We had really, really rich conversations about it. And actually that kind of spiraled and took off where we were able to, host a photo exhibit. The photo exhibit was at our city hall. At the time, the Minister of Housing happened to catch wind of it and show up. So, when we think of the downstream implications around policy, we didn't actually intend for that to happen, but it was actually wildly successful. So it was sort of paying attention to how people really wanted to be engaged and tell their own story and experiences, and then how we could use that to make some shifts around the program that was being offered and even some of the policy decision-making around housing and how housing was being thought of and the infrastructure around it within our municipality. So sorry, that was a very long example.
No, that's a fantastic example. It's very inspiring. Thank you for that. You talked a little bit about some of your work had to do with looking at filling needs in kind of the broader early childhood sector. Can you tell us a little bit about the gaps there and how you feel maybe evaluation helps to fill some of those gaps?
Sure. Thanks, Judith. So as I mentioned in my brief, not so brief personal history, much of my career has been listening to those needs and assets that exist in the ECD sector. That happens fairly informally. So, through conversations, through organizations I work with, through my colleagues that work in the area, and then sometimes really formally through research. So one example is in our province, we conducted dialogues across the province, meeting with leaders in early childhood, meeting with leaders that do evaluation in this space, funders, and we had conversations of exactly that. What are the needs that you're experiencing? What are some of the challenges, but also what are the assets that exist? And how can we leverage those assets around evaluation? So there seem to be kind of foundational issues, and I don't think they're even specific to ECD, but certainly they always bubble up. There's kind of 6 foundational issues that I certainly always hear when I'm involved in those conversations, and they came out of those dialogues we had across the province. So certainly, more and more organizations, program managers, they're being asked to provide evidence of impact. And I think more so in times of fiscal constraint, there's not the same kind of funding to go around, but, funders want to know, is this impactful? Is the investment I'm making here worthwhile? So kind of show me the numbers and demonstrate to me that my investment's worthwhile. So certainly, I think, Rich, you talked about that at the very beginning, right? Sort of that reactive, I have to, because I need to make sure that I've got funding, to continue my program. I find there's significant barriers, and I've heard this, you know, certainly across the field in terms of limited time. So oftentimes evaluation is being done off the side of someone's desk, and they, you know, may not feel like they have, or they're not trained in this. You know, I'm an early childhood educator. I'm not trained in evaluation. That, you know, I had my one maybe partial course on this, but you know, this isn't in my job jar, but now it's in my job jar. So there's really limited resources, and I find this in terms of human resources and even financial resources. So, you know, we say we want to know whether or not, you know, or funders want to know if we're doing a good job around, you know, being impactful in terms of the services we provide to children, but oftentimes we don't set aside the resources to do that, whether they're human resources or financial resources. And also that, you know, and I think Rich, you talked about this, the notion of an organizational culture. So there isn't always that support for evaluation, right? It's like, okay, we just have to get that done for the purposes of reporting. But we're not really thinking about how to embed that in our organizational culture and our learning orientation to say, what does this actually mean for us? You know, bringing it back to that community context, what does it mean for us in terms of growing our programming, in terms of stopping, you know, doing things that aren't working, keep doing things that are working, or try some new things, right? Innovate in that area. I also think that when it comes to tools for measuring outcomes, you know, I think Cheryl rattled off a whole bunch in her presentation, but, you know, this can be a little bit complex too. Sometimes there's too many tools out there. We don't actually know what quality is around tools. Sometimes there's not enough, or the tools aren't context specific. And I think that's where community-based evaluation can really play a critical role, is how do we work collaboratively to maybe co-create tools within the given context that are actually going to ask the right kinds of questions based on the needs or the program that we're looking at. And then sometimes, of course, tools are mandated, right? If you've got, you know, sometimes at our provincial level, we're using or we're expected to use certain tools, and that may not necessarily meet the context in which we're working. I think I said I had 6, and I don't know how many I've rattled off already. I think too, maybe it's going back to that reactive versus proactive, that, you know, I think people feel like evaluation is something outside of their control. Oftentimes it's been top down and doesn't really allow for that same kind of level of community self-determination or innovation. You know, even insights into what does it mean for us to raise healthy kids and support children in our environment. And that may not match exactly the same perspective or theory of change of the folks that are funding us. So how do we come into that middle space to have conversations about what is important information to gather, in what ways, from whom, and how do we actually use it? I think the use piece is really, I can't hammer that point enough.
For sure. And so I think you've touched on a number of barriers to useful evaluation: resources, lack of support. Do you have any other insights on actual barriers to community-based evaluation? Or did we touch on all of those?
Barriers to it. Well, maybe I'll shift it from barriers to how can community-based evaluation actually lift some of those barriers, perhaps, and create a space for making evaluation more meaningful and useful in your organization or in the sector. You know, Rich, when you presented kind of the hallmarks of a community-based approach and some of those goals, and even the GPS map, I love that. You know, that community-based evaluation is stakeholder driven and it's contextualized. So I think what that really reflects is that we're really actively engaging. So when I say we, I'm thinking of myself. I typically come from an outside perspective, but even within an organization is really thinking about who are those that are involved in the evaluation, who has a stake in it, who might want to learn from it, right? You know, those that are deeply interested in the evaluation that's taking place, understanding the context, who can we count on in the evaluation, and who should we be sharing the results with, right? I mean, it's not always just outside to a funder, like even just sort of embedding that practice into, let's share this information back with parents, right? What are we learning about some of the exciting things that are working in our program, or in do, likely feel some kind of ownership over the process, and then probably pretty keenly interested in what happens, right, in those outcomes. So that's sort of following that piece of stakeholder driven, participatory approach, and then really that action orientation. And of
Thank
course,
you.
I've seen countless examples of where, working in this way and utilizing this approach has certainly led to some really positive outcomes for community organizations. So, I think I'm kind of camp Cheryl and Rich, where I say, I don't know that there is another approach to evaluation. It's kind of community-based or bust, I guess.
So we do have some questions coming in. So I encourage everybody to send in their questions for Rebecca. Thank you for that information. That was very helpful. We have a question here. Evaluation as a side of desk job is a real issue in our organization. I've made the argument that we need a staff research and evaluation coordinator or an internal evaluator, but our major funder is not on board. What arguments or evidence would you recommend to argue for the role of internal researcher or evaluation staff in not-for-profits?
Fantastic question, Leah. Yeah, this is a tough one. I think you're right. It's, either off the side of the desk or it gets embedded into somebody's job after you've been hired under a certain job category where that was not part of the job description. What I think it is really, maybe even working organizationally to sort of look at what kind of skills and assets do you have. I've seen organizations go so far as, I guess, again, it's getting your board, if you have a board, or your kind of executive team on board, to really look at starting to build that into hiring practices. So I worked really closely with the Boys and Girls Club, Big Brothers Big Sisters here at Edmonton. And they sort of said, like, from here on in, that's one of the criteria in all of the folks that we hire, right? Is that a portion of your position is devoted to evaluation. So I know distributing that can be challenging, rather than making it one person's job. I've also seen organizations, not-for-profit, which I think is really innovative, where they actually get together and they share the resources of an evaluator. So I've seen like 3 not-for-profits get together because it is costly, and they actually share, so they don't have their own internal, but they're sharing an internal evaluator across different organizations. So that is perhaps another strategy. I don't know, Rich, have you run across this? I'm curious if you have any, like, there isn't a one pager where we can say, here's the, 5 points to argue to your funder, but.
Yeah, no, those are good ideas, Rebecca. And to your last point about the sharing of common evaluator across organizations, a little variant of that. We're in CCBR in discussions with one organization who we've worked with many years, supporting their evaluation, maybe earlier on doing the evaluation with them, and now shifting more, they're doing their own evaluations, and we're kind of more in the backgrounds coaching them. But given all those years, they want to know what's next, right? What's the next step of their progression as an organization? And this is a very small nonprofit, right? It's not that large of a nonprofit, but they're committed to this culture of evaluation. And so we're having conversations about perhaps as we're a nonprofit research organization, perhaps they could share staff with us in addition to other similar organizations. And so having that kind of triangle between organizations who are doing similar things plus a research-based organization, and what does it look like to have what's the business model look like to have a common evaluator across all of those organizations. So that's another variant of the model that you're talking about.
Yeah, and maybe if I jump in again, being at an academic institution, I think that there's huge value in partnering up with academic institutions. So, I know it's not kind of a long-term sustainability type response, but certainly there's lots of opportunities where you can get support from expertise on campus, get connected in with a student. We have lots of, students that are doing community service learning, or they need internships or practicums. Judith, you're a perfect example of this. And, you know, we offer courses actually at the U of A. I'm offering a course that'll be happening right away here at the beginning of June, where we actually solicit community-based cases. And then we have teams wrap around those cases. And by the end of the week, we prepare an evaluation framework for that organization. So no, it doesn't get you into the implementation. So Leah, I'm just looking at your other response of when we've got a lot of diversity, or not even diversity, a lot of programs, it's how do you sort of bring that all into one and kind of get the infrastructure around what could a larger evaluation framework look like. And I think certainly, you know, I would invite anybody, and I think Sherry, you put the ECN's website up there, and you can email us at ecninfo@ualberta.ca. But we do this kind of matching and brokering all the time, and we can look at opportunities to connect you up with some resources and support. And we've, you know, I'm not sure where everybody's located on the call today, but we've got other partners in our network, certainly Rich's gang at CCBR, but other institutions across Canada that are doing very similar work and hopefully could support in the form of a student or a faculty member around, you know, giving you, and maybe it is giving you some of those argument points to your funder.
Mm-hmm.
And I like, Leah, your next comment around the, you know, the usefulness of having a common evaluation strategy or you know, initiative across organizations to make sure that you know, evaluation isn't disjointed and inconsistent. And it makes me think of one organization in Halifax that we're supporting, that they kind of caught the bug of community-based evaluation. They're an organization that started off, you know, as a smaller organization. Now they're quite a large organization. I think 300 or 400 staff. So it's quite a large organization. And so they want to do evaluation, but where to begin, right? And so how they began was kind of a two-pronged approach. One is having a kind of a meta strategy that's linked to their strategic plan. So they have certain strategic directions. And so they have a comprehensive, overarching evaluation strategy that's linked to their strategic priorities. That's kind of, you know, the broad framework that they've set. And in addition to that, they started with one program within their organization that is as a pilot to live out that evaluation framework that they've, or organization-wide evaluation framework. So if you think of in terms of theory of change, they have an organizational theory of change at a really high level. And then they have a program theory of change that links to their organizational theory of change. And for each, they have a steering committee who's guiding that. So they have a steering committee guiding their agency-wide evaluation strategy. And some of those people are also on that program-specific steering committee that's guiding the implementation of their first program evaluation. And then their plan is to slowly spread that throughout the organization. I don't know how long that will take, but if you think of those 4 phases of community-based approach to evaluation, that cycle, they will cycle in more programs as the years go on into that comprehensive evaluation strategy.
Interesting. Thank you. We do have a few more questions. So for either Rebecca or Rich, how can we increase funds for evaluation from both funders and organizations? Helpful hints.
That's the $1 million question. I think, well, in my experience, you know, I think it's sort of continuing to have those conversations, especially if you have an ongoing funder. It's just really starting, you know, having those frank conversations often. Certainly organizations like our network are pushing from that outside to say, you know, there's sort of like the percentage of every budget should have a percentage of X for evaluation. And I think oftentimes that just, you know, gets moved into programming, but being really thoughtful about actually setting aside those dollars and having conversations with your organization and your funders to say, we need to set aside 10% of the budget, because everything automatically always goes to programming, but we have to set this aside or we're not actually going to pay attention to it, right? And I think that's one big piece, and really having conversations with funders about that too. In order to do this work, and you're asking us to report on these outcomes, we need to have the time and space to do that. And we have to set aside money in the budget to do that as well.
So I'll just add add to that, to what Rebecca's saying. Yeah, to me, it raises the question of that enabling environment that we talked about earlier. What's the role of funder in enabling a community-based approach to evaluation to be happening in organizations on the ground? And I think what Rebecca's talking about, is in part that their funding supports evaluation. I think there's also other roles that funders can play to be enabling a community-based approach. One is around capacity building, like making sure that in your questions that you have in the chat, it's part of your challenge is capacity of staff, right? And do you hire a evaluator, or do you just have your existing staff do some evaluation? And so I think it's part of the role of funder as well to build the capacity of existing staff around community-based evaluation. And then a third role, I think, that would be really good to have enabling the environment of a community-based approach is that the particular funders see themselves as creating outcome inventories, not creating the grid, the theory of change that they impose on their funded organizations, but providing those organizations with a sample of potential outcomes from which the organizations can choose. Because one of the hard things about starting evaluation is to thinking about what are all the outcome options and what are the indicators and all of that. That's can become quite conceptual. And I think the role of funder can help organizations to bring together some of those outcomes and indicators and offer that as like a menu of options for organizations to choose and pick according to their unique organization.
Thank you. So I'm conscious of time. We've got 3 minutes left, but we have a bunch of questions coming in here. So let's go with, we have a question here about metrics and measures that are being used provincially or federally or even globally, but that communities don't find those metrics fit or provide meaningful results to help local programs. Thoughts on that?
Yeah, I think actually that was one of the biggest things that came out of the dialogues we had, certainly across our province, is that notion of top-down outcomes inventories. I do find at the top-down they are fairly broad outcomes, right? Like there isn't a lot of specificity to them. And I feel like as a community-based, kind of coming from the bottom up, meeting somewhere in the middle to say, here's what we really are interested in learning about. How do we make that sort of fit into the broader outcome? I mean, if the broader outcome is, healthy development, I mean, that's pretty broad. And maybe I'm simplifying it too much in that, yes, maybe there is more specificity, but it really is that middle space. And that's certainly something that we've come across is how do you not feel like this is being imposed on you and you can actually drive from the bottom? Because actually, I would argue, oftentimes funders create these mechanisms too, and they get a bunch of data. So if you're pushing data up into that, and I see there's a question about surveys, you're pushing data, sometimes that data actually isn't even all that meaningful to funders. So, I mean, I'm trying to push for how do we have really productive conversations about meaning making that actually is collaborative in nature. So even taking that community-based approach up to the level of conversation of funders and community organizations to really talk together about what are important outcomes that are going to meet both of our needs, right? Because there is nothing more demoralizing, and my colleague always says it's like turning a crank that's attached to nothing, right? We're gathering data and we're spinning our wheels and gathering all this oodles of data that actually has no meaning to our program. We're not able to reflect on it. And if only we could just ask questions like, did that meet your needs? What was your experience in the program? So that was kind of a non-answer, but I do think it is, it's not a silver bullet. It's, again, from my colleague, silver buckshot, but it's how do we continue to close that gap between what we think is expected of us and what we actually want to learn, and how do we actually, and sometimes I think people are surprised when you broach a conversation to say, here's what we're really interested in learning. Here's what I understand you want to learn. How do we actually make those two things come in alignment? And oftentimes they're not entirely out of alignment. I think it's just perhaps different language being used. I don't know, is that fair, Rich?
Yeah, no, I think you're
Or
absolutely
it's too
right.
mother and apple pie. I don't know.
Are we okay for 2 more questions before we wrap up? How do you guys feel about that? We've got one question for you, maybe Rich, about the theory of change. What does it mean and where does it come from?
Okay, I think you're looking at a different chat than I've got, but
Yeah, it's in the question and answer one. This is
oh, I
from
see. Okay.
Megan, and maybe
So
you
is
can
it,
say something quick about that.
what is a theory of change? Is that
What
what
is
the
a theory of change? Where does it come from? Maybe a good
yeah.
segue into our next webinar.
Yeah, no, a theory of change is just what you do and why you do it, basically. Like, you know, at its core is about the activities that you do, the set of activities, and how they are linked to the expected change that you're hoping to reach. So activities and outcomes, and the link often shown or within the, you know, graphically within a logic model, but doesn't that need to be. It can be word-based or sung or, you know, video of your theory of change, but that's really what it is. And so evaluation can look at either the process, the activities part, how are you doing those activities that you're intending to do, and the evaluation can also look at the outcomes, the changes that you're hoping to see. To what extent are you reaching those changes, or maybe perhaps there's other unanticipated changes that you're looking. So really, an evaluation is your interrogation of your theory of change, which you've developed yourself. That you know, and we could do a whole workshop just on, and we often do, you know, of how to develop collectively your organizational or your program theory of change, so that everybody's in agreement. Yeah, this is what we're trying to do, and this is the change we're trying to make. And now our evaluation is asking questions of that. And that's what reflective practice is.
Great, thank you. And I think one last comment around from Monica, I believe, about concerns around surveys. So organizations always doing surveys, and people don't always respond to the surveys, and maybe surveys are not always the only or the best method to gather data. How to go about influencing change within an organization, or maybe influence a change in the way to gather information. Any thoughts on that? Our ending question.
Rich, do you want me to take a crack?
Yeah, go.
Sure.
Go.
Yeah, so Monica, often, I mean, certainly when I work with organizations, I always ask them, you know, what information are you currently collecting? And so I think you're sort of talking about surveys as maybe the primary. You find that a little bit frustrating and maybe a little bit limiting in terms of getting at the experiences of participants. And perhaps your participants find that limiting because they're not completing it, right? I think certainly in the pandemic, we're like surveyed to death right now because everything is, you know, getting sent to us links. And what about our experiences? Oftentimes, people are also engaging in data collection opportunities and procedures that they don't even recognize are data collection. So, you know, your intake interviews, your, you know, post, if you're sitting in, let's say you're doing a group process, it's how can you embed evaluation questions and data gathering right into the very programming that you're doing. So it doesn't have to be that pre-post survey and I just send it out at the end. How do you actually embed those reflective questions right into the work you're already doing? Or maybe you're already embedding those questions in terms of intake interviews, welcoming, you know, let's say that we're doing, you know, a family, you know, child family kind of meeting or program. So what I would say is kind of looking at natural opportunities to gather information. So whether though that is qualitative information, right, kind of people's experience, and they tell you right then and there. And then even kind of that post, maybe you follow up with a conversation, maybe it is a survey, but even asking people, how can, you know, in what ways do you want to share your experiences in this program? I think it's looking at the easy, not the easiest ways, I don't want to say it easiest, but the natural ways that you're already meeting and gathering with people and using those opportunities to gather that information. And you might be able to avoid using surveys. I mean, we've done that, and certainly online, you take quick polls, you know, embed a link, ask people a couple questions, and you gather your information right there. So you're not sort of sending it to them after the fact.
That's great. Thank you. Thank you.
I
So
don't
I
know
know
if
we're 5 minutes over,
Mhm.
and I'm conscious of time here, so I think we'll have to wrap up. But if we didn't get to your questions, if there's any in there that we missed, my apologies. But we are doing another webinar in 2 weeks on June the 4th, I believe it is. And so you can sign up for that, and we'll get to your questions at that point for sure. And I'd like to thank Rich and Rebecca and Cheryl, who's had to leave a little bit early. It was fantastic, great presentations and fantastic information. So thank you so much for being
Great.
here. There will be a survey, funny, sent to you by email after this. Please take some time and fill that out. It'll only take a couple of minutes. And we hope you enjoyed today, and we hope to see you again on June the 4th.
And
Thank you,
maybe,
everybody.
Judith, I'll just do one plug before June 4th. We're hosting a lunch kind of and learn about the Evaluation Capacity Network for those that are interested in learning more about it, what kind of, engagement and opportunities that we can offer to you. And then I've got 2 colleagues that are joining us. One is from Manitoba and one is from Ottawa. Ottawa, Isabel works primarily with Francophone communities, and I know this is certainly a gap in terms of support around evaluation, but I encourage you to come learn about other resources and supports that are available to you as well on the 2nd, and then follow up on the 4th. So there's a lot of exciting things
Lots to
happening
do.
right now.
That's
Yes.
fantastic. Thank
Yeah.
you. And thank you again, everybody, for joining.
Take care, everyone.
Bye-bye.
Take care.